broken instruments in the periodontal sulcus. Next topic is principles of instrumentation. First principle is accessibility. Should accessible to that area. Second one is visibility, illumination and retraction. Second principle is visibility, illumination and retraction. Third one, maintaining a clean field of operation. Maintaining a clean field. Next principle is that condition and sharpness of instruments. Okay, the sharpness of instrument should be proper. Next one is instrument stabilization. So you have to study only the names only, no need to detailing. Okay, detailing needed only under two principles and I will discuss it. So first principle, that is accessibility. Second one, visibility, illumination, retraction. Third one, maintaining a clean field. Fourth one, condition and sharpness of instrument. And fifth one, that is instrument stabilization. Here instrument stabilization you have to study detail. In that instrument stabilization, first point is about grasp, instrument grasp. Which grasp is we prefer or recommended instrument grasp is modified pen grasp. Here many grasp are there, pen grasp, modified pen grasp, palm up grasp, like that. Here most recommended position, most recommended grasp, that is modified pen grasp. Okay, this is about first point under instrument stabilization. Second point under instrument stabilization, that is about rest. The rest can be intraoral rest and extraoral rest. Here first we go into intraoral rest. Intraoral rest can be divided into four types. In that first one is conventional rest. In conventional rest, we will take adjacent tooth as rest. That is conventional rest. Second rest is cross arch rest. In cross arch rest, we will take opposite side of the same arch for rest. Opposite side of same arch. Third one is opposite arch rest. Here we will take opposite arch for rest. And last one, that is finger on finger rest. We will place a finger of our hand itself act as a rest. This is finger on finger rest. This is about types of intraoral rest. First one is conventional. Second one, cross arch. Cross arch means opposite side of same arch. Third one, opposite arch. And fourth one is finger on finger rest. This all are intraoral rest. Second one is extraoral rest. This extraoral rest can be two types, palm up rest and palm down rest. Two types of extraoral, that are palm up and palm down. These are the main points included under this instrument stabilization. So under instrument stabilization, first point is about grasp. Here modified pen grasp is preferred. Second, about rest. Rest can be intraoral and extraoral rest. After this, sixth principle, that is instrument activation. Under instrument activation, many points are there. Here first one is adaptation. When we place an instrument on tooth, it should be well adapted to the tooth structure to remove proper removal of calculus and all. That is adaptation. Second point under this instrument activation, that is angulation. Specific angle is recommended for specific procedures. This we already discussed. Okay, specific angulations. Third point under this instrument activation, that is lateral pressure. We should insert or exert a lateral pressure to the tooth surface. Next point under this, that is about stroke. Stroke can be three types. First one is exploratory stroke. That is for exploring the caries or exploring the tooth surface. This exploring stroke, that is light feeling stroke, that is used for exploring. Second one, that is called scaling stroke. This scaling stroke will be short and powerful stroke. Short and powerful stroke, that is called scaling stroke, used for scaling and mainly for scaling. And third one is root planing stroke. This root planing stroke is moderately vigorous, okay, and not powerful as scaling, but it's moderately powerful. That is explorate root planing stroke. These are the stroke involved under instrument activation. So the points under instrument activation are: first one adaptation, then angulation, then lateral pressure and stroke. Stroke can be three types. First one exploratory stroke, that is light feeling for exploring. Second one scaling stroke, that is short and powerful stroke for scaling. Third one is used for root planing, that is root planing stroke, that is moderately powerful when compared to scaling stroke. So these are the main principles of instrumentation. So again I'm going to repeat it. First principle of instrumentation, that is accessibility. Second one visibility, illumination, retraction. Third one maintaining a clean field. Fourth one conditional sharpness of instrument. Fifth one instrument stabilization. Instrument stabilization can be grasped and divided into subheadings are grasp and rest. Okay, after that instrument activation, it can be divided into adaptation, angulation, lateral pressure and stroke. So are the main 6 principles of instrumentation. Okay, after this instrumentation, next topic is about local drug delivery. What is local drug delivery? Here we will use some drug and it is inserted locally in the gingival sulcus area, because for some drugs the concentration of the drugs in the clavicular fluid, that is 8 to 10 times greater than that present within the blood. When we give the local drug into that area, the concentration is 8 to times greater than that of within the drug within the blood. Many examples are there for local drug delivery. This is mainly used for aggressive and chronic periodontitis conditions. Here first example, that is 10% doxycycline. 10% doxycycline we termed as atridox. Atridox, that is 10% doxycycline. Second one is minocycline. Minocycline we termed as Arestin. ARESTIN, that is Arestin, that is minocycline. Third one is chlorhexidine. Chlorhexidine, when we give chlorhexidine as local drug delivery, we'll call it as periochip. Okay, then next one is sub-antimicrobial dose of doxycycline, that is 20 milligram doxycycline, that is called periostat. Okay, 10 milligram doxycycline, 20 milligram doxycycline, that is called periostat. And these are the main local drug delivery therapy drugs. Okay, so first one is 10% doxycycline, that is called Atridox. Second one is minocycline, Arestin. Third one chlorhexidine, that is periochip. Then sub-antimicrobial dose of doxycycline, that is 20 milligram doxycycline, that is called periostat. This is about local drug delivery. In instrument, we commonly used for scaling, the most commonly used instrument is sonic and ultrasonic scalers. What are the mechanisms present in this sonic and ultrasonic scalers? The main mechanism involved in this type of scalers, that are first one acoustic turbulence, second one cavitation. The two principles involved are first one acoustic turbulence and second one is cavitation. In acoustic turbulence, rapid flow, that means that acoustic turbulence means rapid flow of water within this scaler, sonic and ultrasonic scaler. This rapid flow of water that will displace the debris and calculus from the root surface, tooth surface. Okay, rapid flow of water will, or aggressive flow of water that will displace the plaque and debris from the tooth surface. That is acoustic turbulence. Second one is cavitation. What is cavitation? Here they will produce more number of bubbles. Okay, and when the bubbles are ruptured, that will displace the calculus and debris from tooth part. Rupture of formed bubbles will displace the calculus and plaque from and debris from the tooth surface. That is called cavitation. So the two principles involved in the sonic and ultrasonic instruments. Next topic is periodontal surgery. Before start the types of surgery, we have to find what are the indications for this periodontal surgery. First indication is Areas with irregular bony contours. In case of areas with irregular bony contours and any craters and other bony defects. In all these conditions, we have to cleanse that area. For increase this accessibility, we will raise the flap or we will do periodontal surgery. Second indication, that is for pocket removal, elimination of soft tissue wall of pocket. Okay. And third indication is furcation involvement of grade 2 and 3. And last indication, that is infrabony pocket that is placed distal to maxillary third and mandibular third molar, mainly maxillary third molar. These are the main indications for periodontal surgery. First indication, that is areas with irregular bony contours, crater.
Bluetooth device disconnected.